Good morning, members. Good morning. It is the scheduled time and a quorum is present. Thank you for attending today's meeting of the Subcommittee on increasing the provision of residential care places for the elderly. We only have one item on the agenda today, that is measures to increase and enhance manpower resources for the sector of our CHE. Let's invite the administration to come in. There is only one item today, and we have a lot of time for discussion. So let me sum up the follow-up issues from previous meetings. So we want to enhance and increase manpower resources for the sector. With us today are Mr. Ho Kai-ming, Under Secretary for Labour and Welfare, and his team. Some members have pressed the request to speak button. May I first invite the Under Secretary to walk us through the paper. Thank you. The SWD is joining us. We have an aging population and there is ever higher demand for our CHEs. Besides increasing hardware, we are also concerned about the manpower situation, and we are stepping up training and supply of manpower. We want to attract young people and other workers to join the sector to alleviate the need in the foreseeable future. So besides enhancing existing measures, there are some new measures this year as well. There are 3 new measures to enhance manpower for our CHEs. First of all, in Q2 this year, we will implement the special scheme to import care workers for residential care homes. While ensuring employment priority for local workers, we will allow our CHEs to import care workers where there is the need, and we will also relax the ratio of imported care workers to local care workers. Approval measures will be streamlined. Both private self-financing as well as subvented RCHs will be allowed to apply for a quota. After an application is made, the application would be vetted by an interdepartmental liaison group comprising the Labour and Welfare Bureau, the SWD, and the Labour Department, and the director will make a decision. The second scheme is to commission a consultant study in 2023 to commence a holistic review of the skill and qualification requirements of RCH staff, and also to establish a profession qualification framework as well as progression ladder, so that more young people can be attracted to the trade, and also we can retain more talents in the sector. The review will cover RCHEs and residential care homes for persons with disabilities of various care levels and modes of operation. The consultants will visit respective types of RCH to collect service data on site so as to look at the real situation of the sector, and it will last 18 months. And also we will subsidize an additional 11,700 or more students to enroll in the enrolled nurse general training programs in the next 5 years to alleviate the need in the sector. Graduates must work as an enrolled nurse general in non-governmental or private organizations providing such services for no less than 3 years. There are 427 places in the training program this year, 7 times higher than last year. And it is a very popular program among graduates. Between 2017 to 18 to 2019 to 20 academic years, among the 558 graduates, 496 of them work as enrolled nurse general in the welfare sector, with 391 working in the RCHEs. Now we have completed a survey among 186 graduates who have completed or are completing the undertaking period. Among them, 116 are working as enrolled nurse in the welfare sector, with 93 working in RCHEs. We also have other ongoing measures, including the navigation scheme for young persons in care services and the first hire then train scheme to offer training opportunities for local talents. And also under the training subsidy scheme for staff of residential care homes, we will continue to subsidize RCHD staff to enroll in qualifications framework-based training courses. There will be subsidies for them, and also we will support homes to maintain their operation while the health workers and care workers are attending courses. Thank you. Under Secretary, you have given us a lot of statistics just now. Would you please kindly offer your scripts so that we can make reference to the data? The Secretariat will make a copy for members. There are 6 members. They are Dr. Teck Chi Yuen, Ms. Doreen Kong, Ms. Lillian Kwok, Charles Yu Chung, Reverend Peter Kuhn, and Mr. Ben Chen, myself. Dr. Teck Chi Yuen, 5 minutes. Thank you, Chair. As mentioned by the Undersecretary, RCHE's and RCHD's manpower shortage is a long-standing one. The government has resolved to address the issue, so I welcome the new measures. So for care workers, they are frontline caring staff, and in the public eyes, it may be an unattractive job. As a result, not many young people are willing to join the trade, and there are care workers who continue to serve in the industry even after retirement age. So it is not very easy to attract people with ability and stamina to do their job. And it is very important to import care workers from overseas and the mainland, but there are many obstacles to overcome, including different cultures, communication issues, as well as work practice. I don't think there is enough training for local care workers, and the career progression ladder is not attractive. For nurses, well, the manpower shortage doesn't just exist in the RCH sector. There is a general shortage of nurses in the healthcare sector. After serving in public hospitals for a short period of time, because of the lack of training and progression opportunities, many nurses would switch jobs. And also allied health workers, occupational therapists and speech therapists and physiotherapists, no matter how high the pay is, there is still a difficulty in hiring. Now, with the review on the horizon, I hope that you can take forward a holistic review. How can we professionalize the job, that is care workers and nurses, and how we can attract more people to join the trade, and how we can support physiotherapists, occupational therapists, and allied health workers. Now, there will be an 18-month long consultation period. Now, after the findings are available, then you have to approach LegCo for funding and also for formulation of policy. Then I don't think we will see anything happening in the next few years. And if we see no progress in the near future, then it would be tragic. A working group has been established earlier on this year, and there will be an interim report by the end of this year. So if that's the case, we can consider what items should be allocated more funding in the budget. And then in year 2024's policy address, concrete promises and measures can be delivered to the public, and so we can have real improvements in terms of manpower for the care sector in year 2025. Undersecretary, I thank Dr. Dick for his suggestions. We are now preparing the consultancy report, and this consultancy report will be ready by the next policy address. as I mentioned, the consultants will need to study the individual circumstances in RCH, and 18 months may not be sufficient. And we are aware of all the issues mentioned by Dr. Tick in terms of progression ladder and so on, and these will all be dealt with in the consultancy report. You mentioned speech therapists and physiotherapists. So we will explore whether we can enhance the work portfolio of physiotherapists and speech therapists to enhance their workflow. So we are focusing on addressing the manpower shortage of residential care homes for elderly people. It is an undisputed truth that we have an aging population, so we have to do our level best to address the need of the sector. And we don't want to cause competition between local care workers and imported care workers. We will give priority to local workers first, but when situation calls for it, we will have to import care workers. Ms. Doreen Kong, I think we can have a second round because we have sufficient time. Ms. Doreen Kong. Thank you, Chair. Following up on Dr. Tick's question, that is the manpower consultancy report. Now, after the 3-year pandemic, we all see what the situation is like in RCH East. The situation is like hell. Now, the consultancy period is 18 months. We all know that is the usual length. Sometimes it would be longer. But I'm really dissatisfied about the length of the period. We're just talking about a manpower review. Why does it take so long? There have been numerous reports concerning manpower previously. This is not a new exercise. Well, I just made a search on the internet. In year 2009, the University of Hong Kong was entrusted by the Commission on Elderly Services on the availability of elderly services. Well, it is still ongoing. The situation hasn't improved. So I think 18 months is really too long for this new consultancy report. Now, for the next 3 years, there will be an additional demand of 4,500 care workers. I don't want to know the shortage in the near future. I want to know what is the shortage now. Last question, just very briefly, about the navigation scheme for youth, for young people joining the caring trade. Well, for the first 5 years, only 1,158 students enrolled, and with 603 trainees completing the course. So the passing rate, the graduation rate is just 50%. What happened to the remaining half? And among the 603 trainees, you haven't mentioned how many of them are staying in the RCH sector. Concerning the navigation scheme for young persons in care services, I will defer the question to my team. First of all, this is not a manpower study. If you look at paragraph 6, it is a qualification requirements review. So of course, manpower situation will be involved, but the focus would be on the separation of work and different work types as well as different professions. It would cover nurses, occupational therapists, speech therapists, and nurses as a whole. We want to ensure more such professionals are available for the RCH. So this is not just a manpower supply study. A lot of professions will be involved, so more time will be needed. Now, this paper is a bit similar to the one we had yesterday as the panel on welfare services. According to the paper yesterday, for NGO-operated subvented RCH, there is a shortage of 1,551 full-time care workers. Now, every year we are importing 4,000 care workers under the supplementary labor scheme, including the additional manpower in private care homes. We need an additional 7,000. So that's how we arrived at the figure, that is the cap. So in setting the 7,000 importation cap, we have considered the manpower demand at present, as well as the additional demand caused by the enhanced requirements for RCH. I will invite my team to talk about the navigation scheme.
Ms. Perrin Cindy Chan, thank you. On navigation scheme, between 2015 to 2016 and 2019 to 2020, the indicator is to provide 1,000 training quota. In the end, the emission figures reach 1,158. The number of graduates was 600 odd. Some of the young people are young after all. They have a lot of thoughts. They have studied for a year, and they may have other self-enhancement opportunities, or they may even go to the nursing school. So they may have left the scheme halfway. Out of the 603 students, how many of them worked in RCHE? I will supplement on the figures at a later time. Thank you, Chair. Ms. Lillian Kwok. The administration used different methods to iron out the problem about manpower crunch, but then young people lack career progression. Despite the navigation scheme, young people do not see any career progression opportunities. How can you ask a young person aged 18 to 19 to get a salary of 4,500? How can you expect young people to develop their career in this field? When I talked to young people, they told me they couldn't enroll in the Enroll Nurse program part-time, as only full-time students can be subsidized by the government, whether in full or in part. So how can they self-enhance? On an annual basis, they are paying 30,000 odd tuition fees. To low-income families, 30-odd thousand tuition fees will also cause a burden financially. Have you ever thought that you can show them a clear career progression or education progression? Can you also expand the scheme so that young people can first join the industry? Afterwards, the government can deliberate what kind of subsidy or assistance can be given to them for their progression. After all, they want to become a nurse. So you can show them the clear path with which they can become nurses. Honestly, I have seen a teenager who wants to become a nurse very much. Experience can help young people to complete education. From a care worker, they can become a health worker. With self-enhancement, they can become an enrolled nurse, and then at the end of the day, they can become a registered nurse, and they can become assistant in the hospital. You can see that young people want to become nurses at the end of the day. They want to have development. They want to have progression. Can the administration consider how we can assist young people, how we can make them stay in the industry in the long term? Second, on the importation regime, mainly we import workers from the mainland. Under the epidemic, the administration has compressed the application timeline. This is well received by the industry, and we can actually ease the pressure on them. Looking forward, we hope that the administration can keep seeing how we can streamline the application or the recruitment procedures so that they can find it easier to look for talents, to fill the vacancies, at least to respond to the recent shortfall in manpower. Colleagues from the Social Welfare Department can explain the navigation scheme and the enhancement or career progression ladder. We have different schemes such as First Hire Then Train scheme, which runs in tandem with the navigation scheme. It is under ARB scheme. The employer pledges that a job will be offered to you. So these two schemes will not happen in tandem to one single individual. Thank you for your support for our schemes. And we understand that locals should be given opportunities to first join a trade when they are interested. We have held a couple of seminars, and they welcome these schemes as well. Apart from the protection of local labor, there is indeed time. Time is required. After balancing different thoughts, we have put in place different schemes. We preserve the current requirements, but at the same time, we also have an interdepartmental liaison group comprising the LWB, SWD, as well as LD. We hope that we can plug the gap in terms of manpower crunch as soon as possible. We need to work locally to respond to the manpower crunch in the residential care homes industry, but we also need to think how we can open up more residential care homes in the Greater Bay Area. We need to liaise with different cities in mainland China in order to iron out the problem facing the residential care homes locally. Mr. Chao Siu-chung, thank you, Chair. I'd like to remind the administration that we all understand that there is a shortage in care workers. There are over 10,000 local care workers working in different RCH. So I'm concerned that this special scheme imports a large number of workers. This will threaten the job opportunities locally as well as the salaries of local workers. I believe the administration needs to take stock of the scheme, that is, this special scheme, especially when it comes to the importation of workers to subvented RCHs in paragraph number 4 of the documents. RCH must not displace local care workers it employs with imported care workers, and they have to lay off imported care workers first if redundancy is necessary. What kind of concrete plan or measure do you have to monitor the positions of local workers? Can the Undersecretary answer this question first? In relation to details, I will ask the SWD to take the question. There is a shortfall in care workers locally, but the amendments in the residential care homes legislation will also give rise to further shortfall. We need more manpower in residential care homes. That is why we will put in place the special scheme to plug the gap. We already have a regular shortfall, so we need a special scheme to address the problem that will appear soon, that is the shortfall. Will there be any more competition affecting the salary? We understand all these. We have the median monthly wage, which is $14,000 odd. Private RCHs engage local workers as well as imported workers at this rate. The rate in subvented RCH is higher, and we will monitor the situation? Well, can you be more direct? How can you make sure that RCH will not engage imported workers to displace local workers? How can you make sure this will not happen? The Labor Department and the SWD will keep in view the situation. We already have regular inspections. They will conduct inspections in RCH. We will also keep in view the licensing requirements. So we will monitor the situation holistically. First, in importing workers or RCH's importing workers, will you have any requirements in relation to the number of workers and the salaries? You have to take a snapshot to have an idea of the prevailing number, so you will know whether there is any changes in the number of workers locally or those being imported. You will also be able to have an idea of the salary. That is, whether there is any effect on the salary because of the special scheme. Second, will you require the RCH importing workers to make statutory declarations? That is, they will not displace local care workers with imported workers. Where redundancy is necessary, they will lay off imported care workers first. Will you require them to make any statutory declarations in paragraph 5? In paragraph 4 of the documents, when the RCH needs to import workers, they will have to comply with the requirements of the SWD and the LD, which is in line with the prevailing practice. We have not seen any RCH laying off local workers, so they are actually complying with the requirements. If members discover such situations, members can approach the SWD. Well, the administration has not responded to me in relation to the snapshot. Otherwise, well, without a snapshot, we will not be able to know the figures. How can we make a complaint? We do not have the figures. Mr. Chao Xiu-chung, you will have the second round. Next, Reverend Peter Kuhn. Thank you, Chair. We need to be pragmatic. On importing workers, the administration finds it necessary. Whatever special scheme we have, we are just trying to remedy the situation to solve the problem. The problem we are facing will only get serious in time. When we have hired imported workers, will it have an impact on local workers? But then we should concern whether we can really engage imported workers. It does not mean that they will be willing to come to Hong Kong to work, especially when the conditions are not fair to them. Will people in the Greater Bay Area or Pearl Delta River be willing to come to Hong Kong to work? So, in this connection, I'd like the administration to be more pragmatic. Not just a special scheme, not just a temporary scheme, not just courses on becoming an enrolled nurse. We need to compete with other places in relation to importing workers. We need to provide attractive remuneration packages, which is similar to trawling for talents. In practice, any labor coming to a community to plug the gap as long as we can balance the interests of local workers and those of imported workers, then it will be all right. But when we face situation or problems in society, we need to think in long term. I'm not saying that a special scheme is not good enough, but without a long-term blueprint, especially when we understand that the aging population will worsen in Hong Kong, we need to give it a thought. Otherwise, this problem will only persist. It will linger. Will the administration consider making long-term arrangements in order to iron out these problems?
多謝主席。
Thank you, Chair. We share the concerns of Reverend Peter Kuhn. The major source of our imported care workers are from the mainland. Many of them are not from GBA or even the Guangdong province. Many of them are from Guangxi. But we prefer those who can speak Cantonese because most of our population speak Cantonese. Like Reverend Peter Kuhn said, it is similar to the issue of foreign domestic helpers. In Hong Kong, we have very clear legislations, and we are signatories of international labor conventions, and this is a protection for workers in Hong Kong. There are laws to protect labor rights, and it is an advantage compared with other jurisdictions. Compared with other GBA cities, 2 years ago, 26% of our population were aged 65 or above, and that was 2 years ago. Now, among the GBA cities, Guangzhou has the oldest population, and only 11% of them were 65 years old or above. Well, say, for example, in Beijing, they cannot hire all their workers locally. I don't think any cities in the world can do that at this age and day. So I don't think it is realistic to attempt to address the shortage of manpower with pure local workforce, especially with our aging population. So we will take a holistic view of the issue. Special scheme is one of our measures. In terms of the way forward, we will review the efficacy of the special scheme. Like Reverend Kuhn said, it may not be so easy to attract workers from the mainland. There are many workers, if you pay attention to the news, who refuse to leave their hometown to work in major cities in the country. So we will keep monitoring our policy. Thank you. My turn. I think the Undersecretary was right in saying that we can never be able to address all issues with local resources. Of course, that would be best if we can do that. We want to protect local job opportunities, and also we want to introduce quality labor. Well, I think at this stage, it is still possible to import quality workers from the mainland. However, the situation will change with increasing demand for care workers in the mainland as well. So I think training is the long-term solution. So now the government is going to engage a consultant to look at how to improve the career progression path for the trade. Well, I think in engaging the consultancy study, you have to consult the trade as well on how the trade itself can play a role in terms of professionalizing the job. There are stakeholders in the trade who wanted to establish academies themselves to train a batch of care workers who can suit their needs. I think training opportunities should also be offered to imported care workers. So my question is, what trainings what training programs will be available for care workers imported under this special scheme. Now, the consultancy study will take 18 months. During the interim period, a lot of workers, care workers, will have been imported to work in Hong Kong. So we have to pay attention to their career development and their progression opportunities as well. We have to do something even before the findings of the consultancy study are available. So what can be done now? And also the entire sector is competing for talents with the public healthcare sector. Nurses, physiotherapists, occupational therapists, there is a genuine shortage of manpower. Even if there are talents available, would they choose to work in the RCHE trade sector? Maybe it is time to create a new profession who are on a par with healthcare workers in public hospital, but specifically dedicated to the RCHE sector. So will you allow the competition for talents to continue to exist, or will you designate a grade specifically for the care sector? Thank you. Concerning the consultancy study, it will cover how to delineate the work types in the public healthcare sector as well as RCHEs. Now, there are professional insurance policies available for healthcare professionals. So we have to address the insurance issues as well. That's why the consultants will pay personal visits to different RCHs. There are licensed RCHs and there are RCHDs with different care levels. So we have to acknowledge their differences, and it takes time to complete the study. In terms of creating new professions or new work types to prevent competition between different sectors, well, we want to ensure self-sufficiency in terms of talents for the elderly care sector. Well, I understand that there are in different sector there are different considerations in terms of the needs for talents. So when there are findings available from the consultancy study, we will come back to the subcommittee and report to members. Thank you. Dr. Ngan Yu. Thank you. I would like to follow up on the first hire and train program and the navigation scheme for young persons in care services. Now, the figures are very shiny, but I have a question. Would you consider offering financial rewards for graduates who choose to stay in the trade or those who completed the programs? Thank you. I would invite Ms. Linda Law Ms. Lo Miu Han to take the question. Now, in reply to Ms. Doreen Kong's question, between 2015 and starting 2015, in the 5 years, there were 600 graduates from the navigation scheme. More than half of them chose to work in RCH or social welfare units. In terms of a detailed breakdown, how many of them work in RCHEs? Sorry, we don't have the information on hand. Now, in terms of the navigation scheme for young persons in care services, there are 5 participating institutions. For an eligible student who has completed Form 5, he or she will be offered some foundation courses in care. And after that, they would be offered placement opportunities in RCHDs or RCHEs, some 40 hours per week. So outside the work hours, they have to complete as well a 2-year part-time diploma course. So that is how the students are offered training as well as job opportunities at the same time. So after the first year under the scheme, the students would be qualified to register as health workers. After completing the 2-year navigation scheme as well as the diploma course, if they so inclined, they can choose to further pursue study or stay in RCHD or RCHEs to work. In terms of the tuition fee, advance payment has to be made by the students and the fee will be reimbursed in full afterwards. So what if they have financial difficulties? Actually, the participating institutions are NGOs. So in case of any financial difficulties, an appropriate package will be offered to the students to make sure that they can continue to study. Dr. Ngan, you asked whether there would be financial rewards to entice young persons to join this scheme. Well, between year 2020 and 2021, we have enhanced the navigation scheme. We have improved the eligible age range, and also there is a financial reward for completing the 2-year program. For every 6 months of work and study completed, they will be offered a 6,000 cash reward. For those who complete the full course, there will be a reward of $24,000. Chair, she hasn't answered my questions. My question was 20 seconds long, and she spent 2 minutes to answer other members' questions. My question is simply whether there would be a financial reward for those who choose to stay. You can just answer me no. Undersecretary. Now, Ms. Perrin Chan said just now there may not be a financial reward in Dr. Ngan Yu's sense. However, there would be a reward for those who complete study and work for every 6 months. So if you complete the full 2-year navigation scheme, there would be a $24,000 reward. Any more questions? Second round, we have Dr. Teck Chi Yun. 5 minutes, please. Sorry, how many minutes? Maybe 4 minutes. Thank you, Chair. So members have voiced their concerns very clearly. One, whether there would be a regular review. For RCHDs and RCHEs, over the past decade, there has been a serious manpower shortage, and the remediation were taken forward in a patchwork manner. So when there is a shortage, we have a short-term scheme to address the short-term need, but there is no long-term solution. So that's why we're here. We want to take forward a holistic review to address the deep-root issue. Now, the consultancy study will take 18 months, and I think it will take an extra 2 to 3 years in terms of getting the financial resources in place. Now, the SWD, I want to commend the SWD. After the child abuse cases are reported in society, and there was a task force established, and in half year's time there was an interim report. In 1 year's time there is a full report, and many recommendations are already taken forward by the government. So can we learn from the SWD and make reference to this practice in terms of RCHD or RCHE? Now, can you shorten the consultancy reports deadline on the contracts from 18 months to 12 months? When we have the findings sooner, we can make things happen sooner. So everyone is very eager to see things happen. So can the government also hasten things up and make it quicker?
One more thing. On monitoring imported workers, we have received some complaints. The regulatory regime should have been more effective. First, on the review mechanism, I hope that this will be taken forward faster, if possible. On childcare services, it involves any shortfall in manpower or resources. In the policy address, RCH review has to do with statutory requirements or qualification frameworks, such as there are legal requirements in relation to health workers or nurses, whether there will be any changes. We still have to look into it. How we can better professionalize in these areas, and for the how we can provide a better safeguard to senior citizens and the residents, and whether we can provide a blueprint on childcare services in order to expedite the work. We will look into it. On the protection of imported workers, with the current regime, the SLS scheme is up and running. Whether it be LD and SWD, they have their own respective functions. Some licensing conditions have to be met first. Employees, be they local or imported, also have to satisfy the requirements when there is any inspection or surprise visits through whichever means they enter Hong Kong. They will also be subject to any supervision or monitoring by the departments. The departments will also have regard to manpower requirements. When there are more residential care homes making applications, we will see how we can better manage the surprise visits or inspections. Ms. Lillian Kwok. Thank you, Chair. The administration did not answer my questions at all. I asked a very important question. What kind of career progression ladder is there in place? You mentioned navigation scheme, any subsidy. We already have an idea of these. But then when young people join the industry, they lack education qualifications, but experience can stand them in good stead. Then they will be able to pursue further studies to become a health worker or even an enrolled nurse. If you require them to forgo their income, they are also financially in dire straits. You still ask them to pay tuition fees. To somebody who is working, it is impossible for them to do all these. They are already working and you are still asking them to save. What plan does the administration have to show them there is a clear progression ladder to solve the fundamental problems facing the young generation? What is the subsidy scheme in essence? Members mention helping the young. What is your view? As I understand, Ms. Lillian Kwok's question spans two areas: whether there is any part-time course for young people who are interested. They can first become enrolled nurse, and then they can progress to registered nurses. The universities providing enrolled nurses do not offer courses part-time. They offer full-time mode courses. So we need to get in touch with them to see where the difficulty lies. We have to understand why the universities are not organizing part-time programs. An enrolled nurse program entails practicum hours of 1,600 hours. On completion of a program, what kind of career ladder is there in place? Only with a clear career ladder can you help them. Enroll nurses are full-time programs. They have to forego their jobs. There is no part-time program in the market right now. The navigation scheme for young persons in care services allows young people who are willing to study to become a health worker, after which they can still pursue self-enhancement in the future. So the whole program starts from care workers to health workers to enroll nurses or even register nurses. In the whole course, this is the path they can pursue. I understand there are minor issues, though. For example, any requirements in relation to a part-time or full-time mode. Indeed, there are such issues. In the first 5 years, a total of 95 students who managed to become enrolled nurses in the end. While we do not see a long-term development for the young people, local education, local training, local employment are the fundamental concerns. When you cannot iron out all these issues, how can you assure the young people and to entice them to enter this trade? We will provide opportunities to local young people. But when it comes to different requirements in different ranks, we have a strict requirement. As long as the young people are willing to join the trade, you will provide an appealing career ladder for the young people. And I hope that you can take members' views on board in your report, so that the assistance and support rendered to the young people can be more comprehensive. Ms. Doreen Kong, I side with Ms. Lillian Kwok. As Mr. Chao Siu-chung also said, we also need to take care of the interests of local workers. I have a feeling that after compiling this report, despite the issues, we still have to put in place the special scheme to import care workers for RCHs in order to solve the pressing problem. You will, however, be able to tell that it is difficult to protect local workers. You mentioned the navigation scheme to groom local young talents. When it is so easy to import workers, how will they join the trade? The idea is good, but then there are also details that we have to look into. We need to have a very comprehensive regime. Otherwise, when a new system is in place in the second quarter, are we going to handle their complaints only in the second quarter? These are their jobs. It takes 18 months to complete a report. In 2009, as I mentioned in brief, in December, a government panel on elderly care services, there is a consultancy report. The team comprised 10 members, 8 being PhD holders, 1 being a doctor. It took them a long time to finish a report of 65 pages. Between paragraph 205 and 210, the problem of manpower was mentioned. Especially in 2009, it was already mentioned that elderly care services had a manpower crunch. Professional training has been a cause for concern. It's 2023 now, after a dozen years or so. Why are still talking about a consultancy report of 18 months in relation to the career ladder? What is the use of the report if you do not put in place the recommendations? A lot of citizens may have these concerns. We employed officials, we have officials to solve problems for us. We do not ask them to compile a report for us. Can the administration to promise that the current term government will solve the problems facing elderly care services? They should not drag on their feet. In the report dated 2009, the biggest change in the government is that the elderly, the RCH, are different in nature. When you take a look at the budget before 2009, there were RCH for people with better physical conditions. After that year, that kind of RCH have already phased out. Of course, every single report will touch upon the manpower issue. The current term government wants to solve the problem. We want to solve the problem at its roots. We are already amending the relevant legislation, and this will effect a change in the overall sector. Mr. Chao Siu-chung, thank you, Chair. In paragraph 6 of the documents, we can see that the government is working on a report in relation to career ladder and career progression for local health workers. They can take up more jobs in relation to this position. Of course, I welcome this measure, and this should have been done earlier on. Do you mean that you will start with the level of health workers, and we will also build a career ladder for care workers? In the meantime, we will also review the paid level structure for care workers and health workers. Does it have anything to do with the long-standing manpower crunch? Can you give us some figures? When the pay of a certain rank reaches a certain standard, then the shortfall in manpower will improve. The situation will improve. First question, we will also include care workers. The study mainly focuses on qualification framework and the professional skill sets required. So, in relation to salaries or the appropriate paid level, it was not covered. Otherwise, the scope will be too wide. For example, nurses were once required to take blood tests. How we can, rearrange the different manpower in relation to different tasks. In the private sector, it will be left market driven. Thank you. We hope that care workers will also be covered, and its career progression will also be studied, so that young people will be motivated to join the trade as a care worker. In the document, we can see paragraph 11. It mentioned the scheme first hire then train. You mentioned 400 people were employed through the scheme. What is the rate of the people choosing to stay in this scheme?
Any data on the attrition rate? Thank you. Concerning the career progression ladder for young people, it does exist. It is just not rich enough, so we are doing a study to try to improve it. Chair, thank you for members' questions. Like the Undersecretary said, at present there are different levels under the qualification framework for RCHE's workers. They are underachiever in terms of they are academically underachievers. There are students who have just completed Form 3 and they are not qualified to become health workers. But if they are given sufficient time, if they have 3 years working experience after completing Form 3 study, they can enroll in an advanced training program for health workers. It is a 150-hour top-up course to enhance their Chinese and English language skills. And after completing the course, they would be deemed as having the Form 5 qualification, and they can enroll in a course to become a healthcare worker. So after the legislation amendment, for passionate young people who stay in the job with 5 years working experience as a care worker or health worker, they can take a supervisory role in terms of healthcare in RCH. So besides the existing framework, there are also other opportunities. Some people may not want to stay in the job as a health worker for 5 years' time. They may want to pursue other studies so that they can become a senior health worker. But we need a consultancy study to do that. Now, there are tasks which have to be undertaken by nurses, say, for example, intubation and also administering jabs. So the consultancy study will take a holistic review in terms of RCHEs, RCHDs with different caring level and find out what work types can be added. Are we overrunning? We still have time. Mr. Zhao Siu-chung has pressed the button again. I will give him another round, 4 minutes. Thank you, Chair. The Social Welfare Department has not answered me the figure, has not given me the figure of the first hire then train program. Now, the first hire then train program, the labor union has been actively involved in the scheme. We really think it is useful in terms of addressing parts of the manpower shortage. Women and also homemakers are allowed to work in 4 to 6 hour stints on a part-time basis under the first hire then train scheme. So it is really helpful in this regard. I want to know about how many people are staying on in these jobs. Many RCH operators are telling me that they can't manage if everyone is working 4 to 6 hours shifts. They want people who work longer hours. And also, the management cost would be higher than managing full-time staff. Well, you have to address the problem. You have to know whether it is the problem of higher management costs or otherwise. So many care workers would choose to work under the first hire then train scheme because the pay offered would be higher and also the job would be easier. So would you encourage, but however, for the operators, it would be more difficult because it would involve higher management costs. So can you encourage operators to participate in the first hire then train scheme first before choosing to import care workers? Undersecretary. I thank Mr. Zhao Siu-chung for his concerns. Now we are just talking about subvented RCH. For private RCH, they would a higher management cost would be incurred. So subvented RCHs would be encouraged to enroll in the first hire then train scheme first before choosing any other options. So we will explore how we can make the transition from ERB to RCH jobs as smoother in the future. Thank you. Now, importation of care workers will be made available soon. In the past, there were RCHs who could not hire sufficient care workers to fill their jobs. So with the importation of labor scheme inside, there are concerns that the job opportunities or progression opportunities for local workers would be undermined. So please pay attention to the labor rights of local workers. So this is the last meeting of this subcommittee. However, there are issues to be followed up by the administration, which has arisen during our discussion. Say, for example, in the post-epidemic age, the waiting time for a place in residential care home for the elderly has changed drastically. So we want new data on this. In terms of increasing places of RCHEs in the middle to long run, I know there are programs in the pipeline, and you have data in terms of how many more places will be offered and how they will be delivered. So I hope you can give us an update by means of a report. And also we have raised concerns over an issue, that is the use of ancillary facilities situated at a height of 24 meters above ground. So there is a mechanism where no approval would be needed from the Director of Social Welfare before an approval is made. So I want to know the implementation progress of this measure. Thank you. So the SWD has announced that for certain ancillary facilities situated at a height of more than 24 meters or above, 20 meters above ground, no approval is needed from the Director of Social Welfare. What about the update? Now, the Code of Practice for RCHEs has been updated last December for ancillary facilities where elderly people cannot gain access, that is, offices and so on. They are situated at a height no less than 24 meters above ground. So we have held a seminar on the 19th of December last year to brief the trade about the additional fire safety requirements for situating ancillary facilities at a height over 24 meters above ground. Thank you. Concerning these requirements, well, I know you are going to build a new residential care home in the near future. So I hope you can communicate with the fire services departments in terms of enforcing fire safety regulations. And at the same time, increase the number of residential care home places to address the need. So about the short, medium to long-term strategies as well as the present situation, please give us an update later. If there are no more questions and there is no AOB, this is the end of the meeting. Meeting is adjourned. Thank you.